By the time we grow into adulthood, our immune systems have had the opportunity to see many viral, bacterial, and miscellaneous infections and grow immunity such that if you get exposed again, you hopefully will not have a true infection. Same is not the case for children, simply because they may not have seen the infection in the past and their immune system may be learning. With COVID particularly, because kids cannot be immunized at this point in time, they are still having robust rashes from COVID. The rashes that present on children can be quite impressive, particularly if you think about the size of the child's blood vessels. Simply inflammation is more impressive relative to the size of the vessel because their vessels are smaller relative to those of an adult. You can have a vasculitis-like eruption or coagulopathy-like eruption with COVID. Essentially what that means is when you get the virus, if you happen to have a robust immune response, that can cause irritation of the blood vessels and perhaps some circulation issues or clotting in the vessels. And since that happens at the end of the vessel more commonly due to gravity and the smaller size of the vessel and perhaps everyday trauma with hands and feet being busy, it was not uncommon for these vasculitis-like changes or little thromboses or clots to happen along the feet and occasionally the hands. For the typical viral exanthem, including for the COVID rashes, the rash is not contagious itself. And in fact, most of the time, the rash is most exuberant or pronounced after the peak inoculation of the virus as like a downstream ramification or symbol that your immune system is upset and angry at the infection. We can still see COVID rashes in patients who have COVID infections. However, the severity of the disease is often related to the severity or presence of a rash. So the incidence of cutaneous markers for COVID in general is tending to decrease in the vaccinated population.